Honourable Calgary-Lougheed.
Thank you, Mr. Speaker. During estimates for Indigenous Affairs, the minister spoke about the need to fully consult with First Nations before implementing aspects of the climate leadership plan that affected those communities. Wow. He said decisions could not be made unilaterally and must include government-to-government dialogue. But I've heard from First Nations leaders who feel that their input was not fully considered regarding declaring a public health emergency with respect to fentanyl. So to the minister, what consultation occurred, if any, specifically with First Nations groups regarding the fentanyl crisis?
Associate Minister of Health.
And to the member for the very important question, we know that Indigenous communities have been particularly hard hit by the fentanyl epidemic, which is why we're working with leaders in those communities. Further, we've been working with health centres on and off reserve to ensure that supplies of naloxone are readily available, as well as the adequate training is there, so those kits are able to save lives.
Supplemental.
Given the shared responsibility between provincial and federal governments with respect to Indigenous relations and health spending, and given the federal government has designated money to be put aside to combat opioid abuse, and given that in estimates the Minister of Indigenous Relations agreed with me that we have a fentanyl and opioid crisis on our hands. To the same minister, would the declaration of a public health emergency help First Nations to access more resources to deal with opioid addiction and the scourge of fentanyl? And if so, what is your government doing to help them access additional federal support? Minister of Indigenous Relations, please.
Thank you, Mr. Speaker, and to the member for the very important question. We are continuing to work with Indigenous leaders, both on and off reserve, to ensure that we have adequate and culturally appropriate treatments and supports available to all Indigenous peoples, whether they live on reserve or off reserve. To that end, Mr. Speaker, we are also working to establish supervised consumption services in areas where there is the highest level of need.
I didn't know we had a new Minister of Indigenous Relations. Now, given the need to foster dialogue with First Nations so that the fentanyl crisis is quickly and efficiently addressed, and given that other ministries, such as health, rely on the expertise of Indigenous relations to help them develop culturally appropriate practices, and given the unique challenges that each of these treaty groups have in dealing with this crisis, to the Minister of Indigenous Relations, will you facilitate meetings with Treaties 6, 7, and 8 and their representatives to help coordinate the provincial response to fentanyl with culturally appropriate best practices for each
Thank you, honourable member. Associate Minister.
Thank you, Mr. Speaker, and to the member for the question. We have actually taken a cross-ministerial approach to the fentanyl crisis, working quite closely with partners in law enforcement, with Indigenous relations, as well as advanced education and education. This is a very important issue and one that we take incredibly serious as government, which is why we've also been working quite closely with the federal government, not just on how we're going to best and most effectively implement the resources for people using the federal funding that we received at the end of last year, but also with matching funds from our government. Again, I urge the members across the way to support the health budget so we can continue to offer.